it's Erlyn here, and welcome to another episode of Health Talks, the number one TV show for disease management, wellness, nutrition, and a key for a balanced lifestyle. For today's segment, due to popular demand from our viewers, we're going to talk about an important health condition that many people should be aware of, and that is diabetes, also known as the silent killer. But before we start, what is diabetes? According to the World Health Organization, diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. There are two types of diabetes, the type 1 and the type 2 diabetes. Both cause high blood sugar, but they happen for different reasons. The type 1 diabetes is an autoimmune disease where the blood or the body mistakenly attacks insulin producing cells. So the person makes no insulin at all and must take insulin daily to regulate blood sugar. The type 2 diabetes, on the other hand, happens when the body still makes insulin but doesn't use it properly or the insulin resistance. Over time, the pancreas can keep up, leading to high blood sugar. While type 1 always requires insulin, type 2 can often manage with healthy lifestyle changes, medication, or insulin if needed. Now, to give us some knowledge about complications in diabetes management, let us hear it from student nurse Bridget.
Diabetes management is a must since there is an increased risk of cardiovascular diseases, diabetic nephropathy, which is kidney disease, retinopathy, which is eye damage, and neuropathy or nerve damage, which usually causes foot complications due to poor circulation, increasing the risk of ulcers, gangrene, and amputation. So, for the factors in diabetes management, the first one is blood sugar monitoring. Diabetic individuals must always be aware of their blood glucose levels to determine if they are hyperglycemic or hypoglycemic for an intervention to be done. 80 to 130 milligrams per deciliter is the normal range before meals, and less than 180 2 hours after a meal. The second factor is proper diet. A balanced diet and a moderate amount is most essential for diabetic people. The food to consume must not be excessive in sugar or carbohydrates, and processed food should always be avoided. The third one is medication adherence. Prescribed medication like insulin must always be regularly taken at the right time and dosage in order to avoid side effects or dangerous blood sugar fluctuations. The fourth factor is active lifestyle. Moderate exercises per week or light exercises daily should be practiced by diabetic individuals, as it helps in maintaining a healthy weight and body, which can help in regulating blood sugar levels. The last factor is regular checkups. Continuous maintenance is a part of diabetic management, and that involves regular visitation to the respective healthcare providers for the monitoring of the condition of the heart, kidney, nerves, and vision, preventing further complications.
Managing diabetes requires a healthy lifestyle and mindful eating. Monitor blood sugar levels regularly and stay active with at least 30 minutes of exercise most days. Eat a balanced diet with leafy greens, non-starchy vegetables, lean proteins, and whole grains. Choose fiber-rich foods like beans, lentils, and berries to help regulate blood sugar. Opt for less sweet options such as unsweetened yogurt and whole fruits in moderation. Avoid processed and sugary foods that causes spikes. Stay hydrated with water or unsweetened drinks. Lastly, manage stress and get enough sleep to maintain stable blood sugar levels. These habits help improve overall well-being and diabetes control.
Diabetes is a chronic condition requiring ongoing self-management and complex care activities, clinical management, and teaching self-management skills are vital for optimal control of diabetes. Early detection, Early detection of diabetes is crucial for better health management and quality of life. Routine screenings can lead to timely management and reduce the risk of complications linked to uncontrolled blood sugar levels. Detecting diabetes early allows individuals to take a proactive steps to prevent or delay the onset of complications. Regular health checkups and screenings are essential for early detections, especially for those at higher risk. So, what are the higher or risk factors of diabetes? Risk factors includes both modifiable and non-modifiable factors. First, non-modifiable risk factors. Family history. The risk of diabetes increases if the parents or siblings has or have the diabetes. Age. The older you are, the higher the risk, especially after the age of 45. Gestational diabetes. Having diabetes during pregnancy increases the risk of developing diabetes later in life. Next, non-modifiable risk factors. Weight. Being overweight or obese increases the risk. Losing 5% to 10% of body weight can significantly reduce the risk of having the disease. Next is physical inactivity. Regular physical activity helps lower insulin resistance. Aim for at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activity per week. Next, blood pressure. Untreated high blood pressure is linked to diabetes complications. Maintain blood pressure below 130 over 80 mmHg. And lastly, smoking. Smoking increases the risk of diabetes and its complications.
Thank you for your insight, Mr. Bisenio and Ms. Sodina. We are truly honored for your presence for today. And that wraps up today's episode of Health Talks. Diabetes may be a silent killer, but with knowledge, awareness, and right lifestyle choices, we can take control of our health. So for today, we learned so much about diabetes and the ways we can manage it. First, early detection is the key. We should know the warning signs and get regular checkups. Monitor blood sugar levels and follow your doctor's advice. Eat balanced diet and avoid excess sugar and processed foods. Stay active, exercise. Even small daily movements can make a huge difference. Lastly, manage stress and get enough sleep. Your overall well-being matters. If you have any other questions or personal experiences with diabetes, don't hesitate to share us with us through email and our social media account. Again, thank you so much for tuning in to Health Talks, where we empower you with knowledge, inspire healthy choices, and guide you toward a balanced lifestyle you deserve. Remember, stay informed, stay healthy, take care, and live well. Until next time!